us look at the burden of communicable diseases in developing countries. We already know that developing countries have what we term as double burden of disease. This is basically to mean that you have communicable diseases still existing, and as well as the non-communicable disease also rising. Okay, so that is the double burden of disease. It is an illustration of what we term as epidemiological transition. That when countries develop, usually you tend to have communicable diseases decreasing and then the non-communicable diseases increasing. So in this discussion, we want to understand the communicable diseases that that are very common in developing countries. What what mortalities do they cause? And then issues also to do with what factors are associated with these communicable diseases. Okay, so when we talk about the burden of communicable diseases or generally diseases, our emphasis is on uh, three three indicators. Okay, but of course these indicators can be more. We look at mortality, which is about the death that are caused by particular diseases, and then morbidity, the number of people having particular diseases, and then disability adjusted life years. This is also another indicator for health that we shall also look at later. So these indicators, and of course, for each of these categories, that is mortality and morbidity, you have several other indicators in there. Okay, so you have crude and specific indicators related to mortality and also morbidity. Okay, so it is these indicators that we can use actually to understand the health of the population. And we are able to know whether the investments that we are having in health are contributing positively or not. Okay, and public health authorities are responsible for making sure that this health data about mortality, morbidity, and other disabilities, this data is used to inform and to inform decisions that are made to promote health and prevent diseases. Coming back to South Sudan, we can basically say that South Sudan is not very different in terms of disease burden with the rest of the sub-Saharan African countries. So still, we have a problem of infectious diseases, malnutrition. Uniquely, South Sudan is still facing conflict issues. Okay, and of course, these conflict issues have implications on health outcomes. Okay, so we have communicable or infectious diseases leading, but or again, we still have the non-communicable diseases also posing a threat. Okay, so conditions such as neonatal conditions, lower respiratory tract infections, HIV, diarrheal conditions, malaria, maternal conditions, tuberculosis, stroke, ischemic heart disease. These are still problems that are actually affecting South Sudanese. Of course, periodically you will have outbreaks of cholera, measles, and sometimes hemorrhagic fever, Kala-Azar, and Ebola. These are cases that can that happen. So like we said earlier on, developing countries are always having a bigger burden in terms of communicable diseases. And the linkage is that poverty actually, greatly affects the well-being of individuals in developing countries. And that is why you're having a lot of cases to do with communicable diseases in these developing countries. Okay, so the major leading infectious conditions, tuberculosis, you can say that it is causing a number of deaths in millions, and again, you still have the numbers still relatively projected to be high. The same case to malaria, HIV, and also diarrheal conditions. These are conditions that greatly affect health in developing countries. Okay, so HIV, tuberculosis, and malaria, these are very common in Africa, and the countries that have a high burden of this condition, that is malaria, are often those that are having low incomes, weak health systems, and low human development index. Okay, so these conditions, for example, TB and HIV usually occur together. So you have an individual having HIV and then later developing TB. Okay, and then 6 of the top 10 malaria affected countries also have high TB and HIV rates. In this case, we are talking about Nigeria, Ethiopia, Kenya, Uganda, and Mozambique. Okay, so the occurrence of this communicable disease results into deaths, a lot of deaths, and often children are actually affected. So you have increased infant mortality and also under 5 mortality rates. But what is actually very important to note is that the interventions to address this infant and child mortality is these interventions are well known, and they are not costly. Okay, ensuring that you have skilled health attendants to attend to births, and also conducting what we term as safe, clean birth practices, exclusive breastfeeding, prevention of malaria and other infections, and making sure that we have efficient healthcare services. These are interventions that do not necessarily need a lot of investments, but they are very key in improving health outcomes among infants and children under 5. Okay, so a high infant mortality actually indicates that there is a problem with the health system. And if you, for example, ensure that you have access to clean water, uh, good sanitation, you are most likely going to have a reduction in infant mortality, because these infants, the diarrheal conditions actually are the ones that are also leading in causing mortalities among these populations. Okay, again, similarly, under 5 mortality, still countries that are having low human development index still have high under 5 mortality rates. Okay, and you can say that Mozambique, Chad, and Sierra Leone, these are countries that are doing poorly in this regard. Okay, so the life expectancy, of course, like we said earlier on, countries that have a high burden of communicable diseases, you will have reduction in the life expectancy. So it should not be surprising that you still have life expectancy in sub-Saharan Africa declining in the early 90s because of HIV. But later, of course, with the widespread of ARVs, you have the life expectancy basically improving. But generally, we can say that over the years, we have been having an increase in life expectancy. But of course, not all countries are having the same kinds of trends. We have some countries that are having better medical care and therefore having increased life expectancy compared to others. For Latin America, South Asia, and Sub-Saharan Africa, the increase in life expectancy is slower. Okay, and again, not all countries are having similar health outcomes. That's one point. But the second point is that within a country, you can still have different populations having different health outcomes. So that is an issue to do with the internal disparities. So within a particular country, you still have people who are having poor health outcomes or communities that are having poor health outcomes. And for example, in this case, we can talk about rural and urban areas in relation to how they can access healthcare services. In most cases, you find out that poor rural communities actually have poor access to healthcare services and therefore poor health outcomes. And then we have communities that are marginalized in terms of access to resources. They will still have poor health outcomes. On the brighter side is that if countries devote their resources to improving health, it is possible to improve health outcomes significantly, even without a lot of investment in the health sector. So we can look at Sri Lanka, Costa Rica, Cuba. These are countries that have done very well in terms of improving health outcomes at population level without these countries being in a category that we can call as high income countries. They're still low income countries. They are low income countries, but with a significant improvement in health. And this is as a result of improving literacy, that is education, and then also strengthening primary healthcare systems. So these countries do not have a lot of wealth, but they have improved health significantly. Bangladesh, Ethiopia, Kazakhstan, Thailand, Tamil Nadu, that we can regard as success stories. And of course, when we have outbreaks or epidemics, they will generally affect economic growth. Okay, just like the impact of COVID-19. It disrupted a number of economies, labor forces, and public health systems. So this usually will have a negative impact on the progress that countries have been making. And then, of course, with improvement in health, especially from the years of understanding that germs are responsible for communicable disease up to where we are now, there have been a lot of discoveries or interventions and advancements, technological advancements that have significantly contributed to better health outcomes. Advancements in development of antibiotics, vaccines, and new treatment protocols. These have greatly contributed to better health outcomes. And now the focus is not only on treating but also on having preventive healthcare services. So what should countries do? The countries should definitely spend more money on improving um, the health of the populations. And then also, secondly, is having the integrated disease treatment programs, HIV treatment programs, TB, and also malaria. Interventions that are that don't cost a lot. Issues to do with sanitation, improving sanitation, having access to clean water, and strengthening health systems. These contribute a lot to improvement of health outcomes.